Hello, good morning, everyone. Thank you for joining us. I'm going to be talking to you about falls prevention, and our objectives for this course is defining a fall, identify personal risk factors for falls, discuss the injuries as a result of a fall, identify strategies to prevent falls, and educate you on strategies to prevent falls. According to the World Health Organization, they define a fall as an event which results in a person coming to rest inadvertently on the ground or floor or other lower level. Falls are the most common leading cause of injury in 65 years and older. These are some statistics from the CDC that I'd like to share with you. Approximately 10,000 Americans turn 65 each day. 1 in 4 Americans age 65 fall each year. Half will fall again, and that's due to fear of falling. Every 11 seconds, an older adult is treated in the emergency room. Every 19 minutes, an older adult dies from a fall, and falls are the leading cause of loss of independent living. My goal here is not to frighten you. My goal is to give you knowledge, and knowledge is power, and to educate you on the severity of falls. The question that you need to ask is, why do I fall? Some factors are in your control, other factors are out of your control. And the factors that you can control is the lighting in your home. Please put night lights everywhere at nighttime where you're going to be walking. Slippery floors, make sure that your floors are clean and dry. Uneven surfaces, make sure your area rugs or throw rugs are tacked down, and if they are not, you probably should remove them. Pets, small pets especially, get under your feet and you have the risk of tripping over them. Any improper use of assisted devices, any clutter in your pathway that you're walking, especially if you have a cane or a walker, it should be clear and free of clutter. And improper footwear. You should probably purchase a pair of shoes that are very comfortable for your feet that you can walk in. And factors outside of your control, if you have history of falls. Research shows that people who fall will fall again because they fear that fall. And what happens when you fear that fall, you stay home and don't do anything. You remove yourself from your community. You and become even weaker than you were before. We encourage exercise programs that follow up in your senior centers, and make sure you have a strength in your core and your legs. Factors outside your control are also your age, but age is not part of falls are not part of the aging process. So we encourage you to continue with a good exercise program. Medications, you should know your pharmacist, and Danielle is going to talk to you about medications. Be friends with your pharmacist, especially if you have multiple medications that you're taking. If you have medical conditions, know what those are and what medications you're taking for them. If you have impaired mobility and gait, find out if you can get physical therapy or occupational therapy to help strengthen those areas that you're weak in. If you're deconditioned and immobile, again, if you do have that, we want you to get stronger. We want you to try and get into some exercise programs if you can. Decline in cognition and decreased vision and foot problems. The brain, it's one of the largest, most complex organs in your body. Each side of your brain contains 4 lobes. Each lobe defines who you are, how you act, and obviously how you think. Injury to any part of your brain could change who you are. The spectrum of fall-related head injuries is very broad and encompasses all types of fall-related head injuries. You could have minor ones and you could have severe ones. An example of an injury to the frontal lobe, for example, it's the front part of your brain, and it will change who you are. This part of your brain controls how you think, plan, problem solve, how you control your emotions and your behaviors and makes decisions, and judgment about safety awareness. And if that's damaged from a fall, it will change who you are. Another form of a brain injury is a coup contre-ce. You fall and hit the back of your head, or you fall and hit the front of your head, and your brain moves inside of your head, and you can injure the opposite side, and that is a coup contre-ce injury. Most people do not realize that a concussion is a traumatic brain injury. Once you're diagnosed with a traumatic brain injury, such as a concussion, you need cognitive rest as well as physical rest. And cognitive rest means you shouldn't be watching television. You shouldn't be on your phone or on your computer. You should be resting your brain because it's been damaged. And concussion range from mild symptoms to difficulty thinking clearly to severe symptoms of difficulty remembering new information. And the physical part of it is you could have headaches, you could be sensitive to noise and light, and feel tired all the time without a good explanation. If any time you've fallen and you've gone to the emergency room or seen your doctor for it, then you need to discuss ways to help you with that cognitive and physical rest and get reevaluated, because sometimes the process is slow to heal. If you have emotional irritability, you can have just simple things like that, or get really nervous and anxious. And you could have sleep problems. You could just take longer to go to sleep, or you could have trouble falling asleep, or you could just not sleep at all. And those are all signs of a concussion from mild to moderate. There have other injuries to your brain are called epidural and subdural hematomas. And epidural hematomas are usually an arterial injury in your brain, and those are very quick bleeding, and you need to get probably to the hospital and need to see a surgeon to fix that, a neurosurgeon. And then you have a subdural hematoma, which is a vein that's been torn, and you need to get to the hospital for that as well, but it could buy you time to have that surgery. And sometimes if they're small enough, they probably will just monitor you. And you can see from the image that is on your screen that the arterial bleed, how much bleeding there is from the artery versus the vein that's been cut for the venous bleed. And again, these are some other injuries that you could sustain, and that is skull fractures. A compound fracture, a linear fracture, and a depressed skull fracture. Spinal cord injuries are a severe impact on your function. The consequences of the injury depends on the location. Obviously, the neck is the most vulnerable because it is the most mobile and the most exposed. So if you have injuries to your spinal, cervical spine, or your neck, then any injury, if you cut your spinal cord as a result of that, any injury function from below that, you will not be able to move. If you injure your thoracic spine, which is around your chest area, and it can result for injuries below that. And this is where you will need occupational therapy, physical therapy to help with you healing in your healing process. I want to introduce you to Baystate Bobby Bones. And if you can take a look at this picture, and you can see all of the different bones that are in your body and what they're called: the skull, the cervical spine, the clavicle, the humerus, the radius, and the femur. These are bones that if you fall, they could break. One of the most significant injuries that we see here at Baystate are rib fractures. And I wanted to show you what your chest consists of. You have 12 pairs of ribs. You have 7 attached to the sternum and the vertebrae. 3 are connected through cartilage, and 2 are floating and connected to your vertebrae. And I want you to think about, too, what's underneath your rib cage. You have your heart, you have your lungs, you have your liver, your spleen, your stomach, your esophagus. So if those ribs are broken, then you could cut into one of those organs inside your chest or your upper abdomen. Upper extremity fractures. I love this acronym FOOSH, which stands for falls on outstretched hands. Bones are very susceptible to fracture when you fall and put your hands out, and the 2 bones in your forearm or your radius and your ulnar. And if those are fractured, you probably will have functional impairment for your self-care, for driving, for homemaking tasks, work, and leisure activities. And your lower extremity fractures, I want to show you what a femur fracture looks like. It's the biggest bone in your body. And I just wanted to reference that when you break a bone, break the vessels that are attached to the bone, meaning the veins and the arteries. You could have blood loss in that area. Lower extremity fractures also include your pelvis. And from these photos, I want you to see the big red arteries that are in your pelvis. And it's susceptible to fractures as well. And what will impact is your functional mobility of lower body dressing, your self-care, and all your sit-to-stand transfers. Your vision. As we get older, everybody's vision changes. You have decreased ability to adjust to light. That's why we recommend night lights that put them in your house at nighttime, because if you notice when you turn on the light, it takes you a few minutes to adjust to that bright light. So that's why we encourage you to have night lights. And you can get night lights that come on at nighttime, or you can buy the ones that you turn on yourself. You have decline in depth perception, meaning you can't see the edge of the stairs. So that's why it's good to have lights at the light switches at the top of the stairs and at the bottom of the stairs so that you can see those thresholds. And you have decreased vision at night. So some of the tips and tricks we encourage are keep glasses clean, make sure you have a yearly eye exam, mark your steps and your thresholds, improve your lighting in your bathroom, bedroom, and hallways, and make sure you have decreased clutter and keep your space organized. Hearing also changes as we get older, which will sometimes folks limit their social activities because they can't hear. It lowers your feelings of just good health, and it cuts off relationships. So some of the tips and tricks we recommend is use appropriate hearing aids and assisted technology. Get closer to the person that you, especially if you know they're having trouble hearing, or if you're having trouble hearing, get close to the person that's talking to you. Don't talk from the other room because you're not going to be able to hear them. Ask the person to turn and look at you when they are talking to you, and let the speaker know that you're having trouble hearing or understanding them. And if you do have a hearing aid, keep a spare battery on you, because when the battery goes out, all you hear is ringing. There's nothing that you're going to be able to hear at all. So that's why I recommend having batteries. Who is on your team? You are the most important person on that team. We want you to know your primary care physician, your ophthalmologist, your physical therapist, your occupational therapist, any nurses that are involved in your life, your audiologist and your support team, and your pharmacist. I recommend making sure your pharmacist is an important part of your life, especially if you're on multiple medications, and Daniel's going to talk about that in the next presentation. But you are the captain of your team, and you should be on first name basis with your pharmacist, and review your medications. And please know why you're taking them, what medications have side effects to them. And again, they're the part of the team that you have that you should really get to know them. 6 steps to prevent falls from the National Council of Aging. Find a good balance and exercise program if you can. Most senior centers have them, and I believe a lot of them are reopening now. So you should be able to go to the senior center, and as long as you're in physical health and check with your doctor that you can do the exercise program, then you should join the exercise. Talk to your healthcare provider and let them know that you've fallen. There's things in place that they can help you with, and there's services through your senior centers and perhaps through your doctor's offices that can help you coordinate. Regularly review your medications with your doctor and your pharmacist. We cannot stress that enough, because some medications could lead to falls. Get your vision, your hearing checked annually, and update your glasses. Keep your home safe. Declutter your stairs. Declutter the pathways that you walk. Make sure you have night lights everywhere. And talk to your family members. Make sure that they are aware that you're afraid that you've fallen once and you could fall again. Make sure that they are on it. Make sure that there's a check system in place for family members to check on your neighbors, etc. And some falls we cannot prevent. There is nothing that we can do to prevent falls. There's certain things that are part of daily living that are an obstacle to you, and we can't prevent falls. But falls are not part of the aging process if you remain in a good exercise program by strengthening your core, your legs, know your medications that you're on. So we really recommend that you do that.
My name is Danielle. I am the emergency medicine pharmacist here at Baystate, and I will be talking to you today on how medications can impact the risk of falling. So there's multiple ways that are mechanisms by which medications could potentially increase your risk for falling. Some of them have the ability to affect your nervous system, so they can make you drowsy, sedated. You can feel dizzy. It can cause your gait to be unsteady when walking. It can cause blurred vision as well. And other medications can cause feeling of lightheaded and dizziness or syncope, and again, cause you to be unsteady when you're walking due to the fact that they can lower your blood pressure or your blood sugar. And I just want to come come out with this up front and say that this is not meant to scare anyone at all. This is just meant to be informational. I will touch on some commonly used medications, and we know that it is not always possible to avoid the use of these medications. So we just want to give you the tools that you need and the information to make the decisions that are best for you, you know, when you're talking with your provider or your pharmacist. So that being said, do not stop any medications on your own if you do feel that you're having any issues with them, or they might be contributing to whether dizziness or potentially falls. Definitely get in touch with your provider or speak with your pharmacist. And it's important to monitor potential side effects of the medications and how they make you feel, and to discuss it with your provider or your pharmacist as well. The med info sheet that comes along with prescriptions at the pharmacy, pay the most attention to the first 4 symptoms in that list, because those are the most common. So you want to be able to recognize those and pick out things such as dizziness, drowsiness that might potentially increase your risk of falls. I also want to kind of put out there to be cautious when adding new medications or when doses of your current medications are increased, especially when adding new medications. If multiple medications are used at the same time that have similar side effects, especially if the side effects could increase your risk of falling, then these effects can be exaggerated and the risk of falls could potentially be increased. Here I have an example of 4 classes of medications that are commonly used together or potentially could be prescribed together that all have similar side effects. So this kind of goes back to what I was talking about on the last slide. So drowsiness, sedation, fatigue, and potentially. And so you have your pain meds or your opioids, your benzodiazepines, which can be used for anxiety or potentially for sleeping, depending on the medication. You do have sleeping pills, and then you also have muscle relaxers. And so combining any of these medications is going to just exaggerate the side effects. And I also want to say that the medications that I have listed throughout this presentation are just some of the more common examples within the classes. It is not an all-inclusive list. So if you do have specific questions about any of your medications, you know, feel free to ask at the end or to contact your provider or your pharmacist to ask as well. We also have anticonvulsants, antipsychotics, and antidepressants. And I have here lists of medications as well as the side effects that can potentially lead to risk of falling. You've probably started to notice a trend or a pattern by now. So confusion, dizziness, impaired coordination, sedation, blurred vision, drowsiness, and then some here as well as hypotension, because if you're standing up too fast or sitting up too quickly, this could potentially cause your blood pressure to drop with some of these medications, which could then potentially lead to a fall. I also wanted to touch on some overactive bladder medications that patients might be on. So oxybutynin is a very common one. So this can cause dizziness, blurred vision, and potentially some delirium. And I also wanted to touch base on over-the-counter medications as well, especially your allergy meds or any of your cough and cold medications. Diphenhydramine is a big one that could potentially cause like some drowsiness or dizziness. And then there's Dramamine or chlorpheniramine. And I would recommend, especially with combination products, to read the ingredients just so you know what exactly you're taking and then how that combination med could potentially impact you. The next couple classes of medications we have are your antihypertensive, so medications that will lower your blood pressure, and then your antihyperglycemic, so the medications that will lower your blood sugars for those patients that have diabetes. And the important thing with these medications is to know your numbers. So you have, for your antihypertensives, you have your beta blockers, your calcium channel blockers, and then additional medications like prazosin, doxazosin, and terazosin. And any combination of these medications, or especially when you have dose increases, it's important to know how these are going to affect your blood pressure and how they make you feel, because they can cause a low blood pressure, which can make you faint, dizzy, or lightheaded, and then could potentially lead to falls. And then in terms of your diabetes medications, so insulin, glipizide, glyburide, and then some of the newer classes, the canagliflozin and pagliflozin, these medications here are that I have listed here are known to cause hypoglycemia or low blood sugar on their own. If you're taking additional medications in combination with one of these, the risk of your blood sugar dropping too low could be increased as well. And similar to hypotension, when your blood sugar gets too low, you can also feel dizzy, lightheaded. You could be confused, have some blurred vision, and then be unsteady with walking, and which could potentially lead to a fall. So we want to know our blood pressures, and then we also want to make sure that we're checking our blood glucose to know where we're at and know how these medications are affecting us. I also wanted to touch base on diuretics. These can also cause hypotension. They cause you to lose fluid. And when this happens, it can decrease your blood pressure and could potentially also make you dizzy. And they are also been associated with what is called orthostatic hypotension, meaning that when you stand up or sit up too quickly, it can make you feel a bit dizzy, which could potentially lead to falls. And I also wanted to mention to try to avoid taking too close to bedtime. This will help to avoid you having to get up when you're sleepy and to have to use the bathroom. And this will also prevent having to try to navigate the house and different pieces of furniture in the dark. So the further away from bedtime, the better with your diuretics. And over to the side, I have some commonly used diuretics listed here for your information. I was also asked to touch on some cannabis and edibles and CBD oils now that they're becoming more readily available in the community. So marijuana can cause some hypotension, can make you feel dizzy or drowsy and fatigued, and can cause some disorientation and impaired coordination, especially when it is taken in combination with other substances such as alcohol or other medications that can decrease your nervous system functioning. So this would be like some of your pain medications or your anxiety medications. And the products will affect everyone differently, so it is important to know how they affect you if you so choose to use them. The THC component of these products is the part that is most associated with like a high feeling, in that so impaired, potentially impaired coordination and disorientation. CBD products are less likely associated with this, but if you take enough, you could potentially have drowsiness as well. And there's also topical products out there, and these are less associated with any of these negative side effects just because it's its activity is more localized to the area where it's being applied, and you aren't taking it systemically or consuming it. And also would like to mention that if you do decide to use any of these products, to make sure that you're getting them from a reputable source. One last thing that I wanted to touch on is that not only can medications themselves and the side effects potentially increase your risk of falling, but there's also medications that can increase your risk of injury if you do happen to fall. And so the main groups of medications in this aspect would be your anticoagulants and your antiplatelet agents. So your anticoagulants, you have your warfarin, apixaban, rivaroxaban, dabigatran, and then some of your injectable agents, enoxaparin or fondaparinux. With warfarin, it's important to make sure that you're getting your INR checked so you know where your numbers are, and adjustments can be made if necessary. And these medications are going to prevent blood clots from forming. And then you have your antiplatelet agents, so aspirin, clopidogrel, ticagrelor, prasugrel, or dipyridamol, and these prevent your platelets from sticking together and forming a clot. So if you do happen to fall on these medications, you potentially could have an increased risk of injury because there is a delayed time to forming a clot. So if you do fall, please make the call. Don't wait to get evaluated. You might feel fine at that time, but however, there still could be some significant injury. There could be a small bleed that has started that just might not be big enough yet to actually start causing significant problems. So it's best to be evaluated sooner rather than later. And finally, if you really have any questions or concerns about your medications or how any of them might potentially interact, contact your local pharmacist or reach out to your provider with any questions or concerns that you might have. And I hope that was helpful today. And if there's any questions, please feel free to put them in the comments at the end. Thank you.
All right, today we're going to be talking about how to check your home for safety. So there's lots of things we can do to keep our homes more safe as we're moving around, because we don't want to be falling in our house, but that's obviously why we're here today. So I'm going to go through different rooms in the house, and we're going to talk about what we can do to make them safer for all of us as we're moving about and completing our daily activities of daily living. So I always think of the obvious. We're going to start with the floors. So first thing I notice when we walk into homes is anyone, especially who has area rugs, carpeting, we want to make sure that those rugs are secure on the ground. You can secure them with backing tape. You can secure them with the non-slip grippers underneath. If you have wall-to-wall carpet, make sure that that carpet is not buckled or coming loose on the edges. You want to make sure your transition areas from one room to the next are clear of any wrinkles, folds, things on the ground. They can be really hazardous. We don't want us to trip while we're moving through the house. When you're moving throughout rooms in your home, you want to make sure that there aren't things that are on the ground. You don't want shoes laying around. You don't want clutter on the ground, stacks of newspapers, magazines. Those objects that sometimes we keep lower to the ground, like the magazine holders, low coffee tables, you want to make sure that they're not in your walkway, so you don't have to go around objects as you're moving through your living room, your hallways, and your kitchen. I'm going to talk about stairs. Stairways are extremely important because you don't want any objects on them. Sometimes I put things on the stairs that need to go up to other rooms in the house. You don't want those on the stairs because people are often moving quickly up and down stairs, and you don't want to trip on them. A great way to keep stairs safe is to have hand railings on both sides of the stairs. Now, hand railings are usually standard on one side of the stairs, but you can add one to the opposite side, but you want to make sure that they're secured appropriately to the studs in the walls so that they are secure and you can use them to prevent a fall. Again, with stairways, we want to make sure that they're well lit. Now, there's different ways of doing that. You can have lighting that you flip a switch at the bottom and at the top of the stairs. But you can also add strips of lights on the side of the stairs that illuminate when there's dim light. You can put them at the base of each of the steps so that you always have ample lighting when you're going up and down the stairs at different times of the day. If you have oxygen that you're using in the home, some people have very long oxygen lines. You want to make sure that those are long enough that you can lift them off the ground and secure them appropriately as you're moving through the house, because you don't want to trip over one of those oxygen lines in the home. Let's see. So the next thing we're going to go through is the kitchen. The kitchen's my favorite area to reorganize, because if you think about your kitchen in little stations, it makes a lot of sense to organize like a coffee station where you have your mugs, your coffee, any kind of additions that you add to your coffee or your tea, all in one area. And you want to make it in an area that's convenient for you. So if you like to have tea every afternoon, you know that your teapot is near the stove and that you're able to easily get it filled with water, and there's a teacup and your tea essentials right next to you. So if you have all of those things in one area, you don't have to reach up in the cabinets, stoop down low, and you don't have to worry about those items that you use on a regular basis getting in and out every day. Often if you're using the dishwasher or the oven and you have poor balance, an adaptation that you can do is you can sit next to those just to the right or to the left on either a chair or on a walker that locks, and you can open up your dishwasher or your oven and remove items from that and put them in a safe area. You don't want to be, if you're somebody who has poor balance, picking out something out of the oven that's super heavy can be really dangerous. So often what I'll have people do is take heat protectors and put them right next to the oven where you can put something down on, and then you can use your counter and slide those heavy items instead of trying to carry it. Often in kitchens, there are things that we don't predict. Do you have little friends visiting, little grandchildren? Are you pet sitting? Do you have pets? So you're going to want to look, if you have visitors or animals in your home, you want to make sure that the ground is clear. Make sure that there's no spills from water, from food, from pets, from children, no little toys around, especially around those pet feeding areas. When we're feeding our pets, sometimes things spill to the side. We want to make sure that those areas are clean and dry so you don't slip on them when you're moving quickly throughout the kitchen. Don't be hesitant to use a piece of adaptive equipment in the kitchen. Some people use those reachers that have the grabbers. You can reach items that are light to grab things that you don't have to reach up in the cabinets or down low for. The bathroom is the next room that we're going to talk about. Frequently falls occur in the bathroom. And for me, I always tell my patients that this is a very vulnerable area. You're often handling your business and in an area where you don't always have clothing on. All the sides and all the things in the bathroom are very hard. So slipping and falling in the bathroom can be extremely dangerous. You want to be really careful about those throw rugs that people keep in the bathroom. I once had a patient, he ended up having a horrible shoulder fracture because in the middle of the night, he walked into the bathroom and he forgot that he just put a new rug in the bathroom, and he fell and he went flying and really shattered his shoulder. Hence, there is no longer throw rugs in the bathroom because it can be super, super dangerous. The other side of that is in the bathtub, you do want a gripping area so that you don't slip when you're stepping into the tub. So sometimes you can use those peel and stick texture pieces that you can put into the bathtub. You can use a non-slip rug that you put in and secure into the bathtub. And long-term, sometimes you can retexturize the bottom of your tub if it's super slippery to make it less likely to have people fall or slip when you're inside the bathtub or shower floor. Consider having more grab bars in the bathroom. One of my favorite things is my father-in-law, who has a really bad knee and has had some recent surgeries. He put a grab bar that is just up and down in that vertical position right next to the shower, so he can hold on to that and step in to the shower and have that security right next to his shower area. Don't be afraid to use adaptive equipment. There are stools that you can get to sit in the shower. You can get them at most local pharmacies, medical supply stores. There are tub seats that you can just sit down into the shower. And there are tub benches that you can have coming outside of the tub. So if you want to sit down on the outside and then swing your leg in, there are adaptive equipment things available. They're not often covered by insurance, but they are for your safety, so it might be a wise investment. Getting a handheld shower is a wonderful idea because when you're in the shower, you are able to sit down, shower yourself independently, and then turn off the water without having to stand up and move too far away from your seat. Consider getting a raised toilet seat or grab bars right next to your toilet. That will help you guide yourself and secure yourself getting on and off the toilet. Make sure that you have a nightlight in the bathroom. Often when we get up in the middle of the night or when the lights are low, especially this time of the year, you'll find that our lights are dimmer. Going into the bathroom, you want to make sure that you have lighting. So especially if it's nighttime, when you turn on a light, sometimes you end up over blinding yourself because you're not used to that bright light that comes right into your eyes. Make sure that you have those dim lights lit so you know where you're approaching. Your eyes have a moment to adjust before you turn on the lights. And again, make sure that in the bathroom, if there's any water on the floor, you have it cleaned up. You don't leave towels on the ground. You make sure that all the areas are as clutter-free as possible. And speaking of the bathroom/bedroom, make sure that, we're talking about bedrooms. If you get up frequently in the middle of the night to go to the bathroom, make sure that there is a clear path to go to that bathroom from your bed. You want to make sure that you have next to your bed either a flashlight or a table lamp that you can turn on or a nightlight that's on, because you don't want to be walking in the dark. It's a very dangerous thing to do. You often might not notice that you had a pair of shoes on the ground or your slippers, and you're tired and groggy. What if your cat goes flying across the room? So you want to make sure that you have well-lit areas, especially when you're moving and we're not as steady in the middle of the night. If you are somebody who gets up frequently and has poor balance, consider putting a bedside commode next to your bed. A lot of people are hesitant to do this, but if it's for your safety and to keep you as independent as possible, it might be a good idea to have a commode right next to your bed that you can have emptied in the morning or you can empty yourself. Because getting up in the middle of the night and falling is a very common occurrence, and we want to avoid having these things happen. Make sure that you have a phone in your room that's either close to your bed or next to a walker or a cane. And when you are moving throughout whether it be nighttime or during the day, that you have those things with you. I once had a patient who used a walker in the middle of the night, and what they did is they duct taped a flashlight to their walker. So they would just use that little flashlight that would illuminate the floor and their feet, so that they were able to make sure that they walked appropriately to the bathroom without having any kind of trips or falls. Again, in the bedroom, make sure that you look on the floor, make sure the rugs are not buckling or wrinkled, and you might need to have those removed to secure more safety. Other safety tips, and I just said this, make sure that you have a cell phone or a house phone with you when you're moving around the house. Make sure you take those phones outside. This time of the year, there are leaves on the ground. There are divots in the grass or in your walkways that you may not have noticed. There is ice on the ground as it gets cooler at night. You don't want to fall outside and have no way to get any kind of help. So make sure you try to start to carry a phone with you. Even in your home, there are ways to have help, whether it be if you don't have your cell phone or phone with you. Some people get the lifelines. Or another option is to have an Amazon Echo or an Alexa that you're able to call or to yell for, that could either call 911 or call a family member to come help you if you needed it. It's a great way to keep ourselves safe at home. When you stand up or when you're moving throughout the house, we all have a tendency to try to do way too much multitasking. And I think as we get older and it's a little bit harder for us to move, or, some of our medical conditions or medications, we're so used to moving so quickly. But when we do stand up, we should really take a minute to stand. And I don't mean like a full minute and like every time you move, but if you stand and take a nice breath or count to 3 and then start moving, it often will reduce that kind of wobbly feeling, or sometimes people get a little bit dizzy when they stand up. So make sure that you are ready to move before you start moving. Try not to rush and put unnecessary pressure on yourself. So as you're moving in and outside of your house, also think about, do you need a railing? Do you need a grab bar to help you get in and out of the house? Would that be a safer thing for you? make sure that those pathways are cleared. Make sure when you you look around your environment as you're getting in and out of your cars. The uneven surfaces, the water, the ice, the leaves right now. And when you get in and out of your car, make sure that you have a hand on the door and on the roof or on the side piece that's not movable. And sit and then swing your legs in if possible. When you start to decrease your balance by lifting up a leg, you're more likely to fall. So make sure you sit first and then swing your legs in. And it's very common, as for the last year and a half, at least since COVID, that people have reduced their amount of socialization and going in and out of our environments. Well, the holidays are coming, and I think, make sure that when you're going to a new environment, whether it be a family member, a friend's home, or to church, or to any of the, senior centers, or any of your outings, that you take a little bit more time to be aware of your surroundings. Falls frequently happen when we're in areas that we're not familiar with. So, take a little bit more time looking at the parking lot, making sure when you're stepping that you know where you're going, and, planning for a little bit more time in those unfamiliar areas. Because we don't want to fall when we're being social, when we finally get to do so, when it's safe. All right. If there's any questions, we'll be happy to answer those at the end. But what I'm going to do is to start to transition to our next section, which is by Nancy Densmore. She's our physical therapy assistant, and she's going to be talking about keeping us moving.
Hi, my name is Nancy Densmore, and I'm a physical therapy assistant here at Baystate at 360 Bernie. We have that falls prevention program here, and what we want to talk about is to keep us moving. I always say to everybody, life lied to us. They told us that we could sit on that porch with the rocking chairs and waving at our neighbors with a lemonade in our hand and have a good long life. But they lied to us. Many of our patients always say to me, "Oh, the golden years are not golden anymore, Nancy." Well, the reason they're not golden is because we stopped moving. The problem is that they forgot to tell us that we have to move more when we get older. We've got to get up and we got to keep going. If we sit, we start losing that mobility, the muscle mass that we need to keep us from falling. So what I'd like to do is I'm going to ask you questions. And these questions is, have you had a fall in the past year? If you say yes, remember that. We're gonna go on with that. Did you feel unsteady when you're walking? Like that time when you're walking down the hallway and you kind of drift into a wall, but you think it was the wall's fault that you hit it, but it really was us. Remember, those are signs telling us that our muscles might be weakening, or there's something wrong and we need to take care of it. Or did you ever have the fear of falling? I can tell you a personal experience. When you fall, that fear of falling is strong and it stays with you. But the problem is that also can cause you to fall, because then we're too careful. Then we're looking out for things and then we stop moving. Right? So what I want to do is I want to talk about some exercises you can do at home, just some simple basic things to start strengthening up our muscles. The first one is a toe raise, which I like to say a heel and toe raising. So what you're going to do is when you're sitting in your chair, and if you're watching this program right now, what I'd like you to do is sit in the chair, put your feet flat on the floor and your hands on your thighs. And what you're going to do is push your toes down into the ground, lifting up your heels, and then holding it for 3 seconds, 1, 2, 3. And then you're going to lift up your toes up in the air, and you're going to hold that for 1, 2, and 3. Now, this exercise, as I'm talking, keep doing that over and over again. But as we're walking, this is the movement our feet have to do when we're walking. They have to get our feet up out of our way so we can bring our heels down and we won't trip on them. But what it is when we start losing that mobility, we start losing that mobility to get that foot up and out of our way. The second exercise is going to be a hip flexor. So that's the motion that brings our legs forward when we're walking. So you're sitting with your hands on your thigh. You're going to just lift up your leg up to the sky. Hold that for 1, 2, and 3. Now do the other side, lifting it up, holding it for 1, 2, and 3, and bringing that back down. Do it again. Bring that other leg up. 1, 2, and 3, and do the other side again. 1, 2, and 3. I want you to keep doing that for just a few moments while we talk again. This motion is when we're standing up. This is the motion that helps to bring our leg forward. Then we bring our toes up like that last exercise, and then our heel hits the ground. That's the way we safely walk, and that's the way we prevent ourselves from falling. Because a lot of times we can trip on our toes when we're doing that. The third exercise is long arc quads. That's your quad muscle. That's the one where your hands have been sitting on your thighs. Those thighs are your powerhouses. What they help you to do is get out of that chair, up those stairs. They help us to get down the hallway, out to the car, into the car. Those muscles do a lot of activity. So to do this exercise, you're going to sit way back in your chair if you can. And all I want you to do is just to bend that knee forward. Yep, lifting it right up, holding it for 1, 2, and 3, and bring it back down. Now you're going to do the other side, lifting it up for 1, 2, and 3, bringing it down. You're going to do it again, lifting up, 1, 2, and 3, and the other side, 1, 2, and 3. Keep doing that just for a few more times while I talk about it. Now you're going to feel those thighs. Some of you are going to feel those thighs feel like they're burning or they're working, but that's good. We don't want to overdo it, but we want to get those muscles to wake up. Like we said before, last year, a lot of us sat around sitting. You got to be careful when you're sitting in front of that television. We don't realize that a half an hour, 2 hours, 3 hours even, some of those movies we used to go to see, they lasted about 3 hours. And we're sitting there and we're watching it for that amount of time. So this last one we're doing is a sit to stands. To do it properly, a lot of people say they can't get out of their chairs. It's too hard. You know, we sit for too long and we get like we call moviegoer knees. Our knees hurt. That arthritis in those knees, it bothers us when we stand up. But when you use the technique and you put it into a proper form, it's easier to get up. So what we're going to do is the first picture shows you sitting up nice and tall. What it's not showing you is you need to move forward in your seat. Get to the little bit of the edge. We don't want to get this much of us off that chair. We want a little bit less of us getting off that chair. What we're going to do next is we're going to lean forward. That's the motion we tend to lose. I'm not sure why. Maybe it's because we're fear of falling. Maybe it's because we lose some strength as we're going along and we don't realize it. But we forget to lean forward. Our nose goes a little bit past those knees. That's a good lean. And when we go to stand up, we lean forward and we stand ourselves up. Make sure those eyes are looking ahead of you once you're standing, because our eyes lead our body. If they're looking at the ground, so will our body be. And that's where we'll feel off balance, because we're still looking down. So our body's thinking we're still going down, but we're not. We're coming up. So remember, it's scoot forward in your chair. Lean forward as you go to sit up, and stand up nice and tall and look forward. Check your posture. Make sure your feet are not together. You want your feet to be hip width apart. That means your feet are under your knees and your knees are in line with your hips. You want to make sure that all three of those things are in place. If our feet are too close, it's like standing like a tree. If you really go to push that tree down, it's going to fall. So we want to make sure that we have our feet in a good position and we feel strong when we're standing. Again, like Michelle said, when we stand up, take a moment to take a good deep breath. Take that moment to make sure that we're not dizzy, we don't feel off balance. If you do, sit back down, wait for a second and try it again. The problem is that a lot of people will fall because they'll stand up, they'll take a step too quick, and they'll fall down. That's not what we're here for. We're here to keep you up and moving. So then we have our screening questions again. Did you answer any of those yes? If you do, you might be a candidate for our Falls program. If you do see that, you can always speak to your doctor and get a script for physical therapy for our fall prevention initiative, the FPI program as we call it. And it's an 8 session program. We start off with some easy biking to get some of that endurance back. We have these exercises that you deal with laying, then you're sitting, and then you have standing exercises. We progress as you progress into these exercises. We also challenge your balance because remember, as we were kids, we've always challenged our balances. We walked on those railroad ties. We jump rope. We worked on our bikes. We did all of our skipping and all that other stuff, which kept our balance very strong. But as we got older, people started telling you, stay off the grass, don't walk over here, stay on that level surface. And the problem is that it actually hinders us because we don't work on that balance properly. When you come and see us, we have different areas that we can work on to strengthen up that balance, including muscle strength, endurance, and then again, your balance. So I think that's about all we have for today. But again, you can just go see your doctor, get a script, come and see us if you feel you have answered any of those questions, yes. And we'll get you back to being strong, get you back to your life. Thank you.
Thank you, Nancy, and thank you, Michelle. We invite anyone who's attending today to type your questions in the Q&A box, and we'll just take a minute or two to answer any questions. One question that's come up is, are there any tests to show problems with balance?
Are we up? Yep. All right. It's me, Nancy. I'm back. Yes, you can stand in front of your kitchen sink. Put both your hands on your kitchen sink and see if you can stand on one leg, even holding on to that sink, and see how hard it is. If you can, take one hand off and see how hard that is. If that is hard, that's indicating that there's something going on with strength and balance and endurance. And that's usually one of the good signs. You should be able to stand on one leg because when we walk, we actually single leg stance when we're walking. It's only for a few seconds, but we need that ability to do that. So that's one of our tests. Here, if you come to therapy, we also have what we call a time up and go. That's where we're standing up and we have you go to some cones, you come back and sit down. We see how long it takes you to do that. We also have a Berg balance test, and that runs you through different courses like standing on one leg, tandem standing, meaning one leg in front of the other one, standing up and sitting back down. Do you need your hands? Can you do it without your hands? Do you need assistance to do that? Those are all signs of that there's something wrong with our balance.
Thank you, Nancy. There is another question, and this might be for Ida. What are the top 1 or 2 things that make people fall?
Hi, our data shows that most people fall downstairs and injure themselves falling downstairs. Others are, they trip and stumble on things that are in their way, meaning that's why we stress about decluttering, especially if you have a walker or cane in your home, decluttering your pathways, not having cords in front of you, and again, improving your strength and your legs and your core by getting into a good exercise program. So those are some of the things that, and other folks, I'm going to go by my own example. My mom, she put a gate at the top of her cellar stairs because her stairs are very steep and she has an old home. And that's like a safety feature that she put there to help prevent her from falling because her balance is not good. She's 86 years old and she's struggling, even though we tried to talk her into doing other things. She's living, her best life. And so those are some of the strategies that we've taught other people to help prevent falls.
Thank you. This next one is for Danielle. This person is on a new blood pressure medicine and they're feeling a little dizzy, and they wonder if they should just give it time to I guess work, or if they should talk to their pharmacist and get it changed, or what would you say about that?
One question I would probably also ask is like, have they checked their blood pressure when they have this feeling that it might be that, like when they feel dizzy? Because if it is like potentially making their blood pressure too low, which might be causing the dizziness, then maybe the dose might need to be adjusted. But sometimes it does take a little bit of time for the body to adjust to new medications. But if they're having concerns, I would definitely reach out to their provider and then their pharmacist where they get the prescription filled as well. I mean, the pharmacist could give some advice on some alternatives. The provider would ultimately be the one that would have to make the adjustment. But it could be the med. But I would recommend checking the blood pressure if they have a machine at home when they're having this dizzy feeling to see if it's that. And then, yeah, talking to the provider if it's still going on past a couple weeks.
Thank you. And we'll just give it another minute. Looks like there's one more question, and this is about rugs, and obviously this might be for Michelle. Will the rug double-sided tape be enough so that I can so they can keep their lovely rugs on the floor?
I think it really depends on how thick the rug is. You can try it, but certainly secure all the edges to make sure that you could do that. But if you have a device that you're walking with, it's probably best to not use any area rugs. So if you're using a walker or a cane, we often suggest to remove those rugs. But if you don't have those things, definitely making sure all of those edges are secure and it's not a super thick rug.
Great, thank you. It looks like that will be the end of our questions for today, but I want to thank all of our Baystate Health experts for a great presentation today. Thank you, Danielle, Ida, Michelle, and Nancy. We appreciate you and our audience for attending. Thank you.